Hello?
Hello, Mr. Jones. This is Dr. Quinn. I have the results of your bladder cancer test.
Doctor, I hope you have good news for me.
Mr. Jones, your test results indicate that you are clear.
Thank you, doctor. Thank you.
For the year of 2018, the American Cancer Society predicts that there will be more than 81,000 new cases of bladder cancer in the United States alone.
My name is Dr. Timothy Quinn. The most important factor when treating cancer is early detection. Bladder cancer begins when cells in the urinary bladder start to grow uncontrollably. I can't overstress the importance of understanding just how dangerous this cancer can be.
Bladder cancer is the fourth most common cancer in men. The chance men will develop this cancer during their life is about 1 in 27, according to the American Cancer Society.
I have great news. There's a new test with the potential to save many lives. This new test, which uses new technology with the potential to revolutionize how we screen and diagnose cancer in the early stages, is the Plain Yard Test. Major research at Johns Hopkins University has resulted in the highly accurate, non-invasive Plain Yard Test by BCD Innovations, which is now available for Mississippians.
BCD Innovations is excited to introduce the Plain Yard Test for the detection of bladder cancer.
My name is Larry Agolnik, Chief Operating Officer of BCD Innovations. Primary care physicians are being called upon to do more than ever. Primary care providers coordinate care for an aging population beset by chronic disease, improve the overall wellness of the population, control costs, and eliminate waste and fraud. These tasks validate the importance and necessity of primary care, but they present daunting challenges nonetheless. But after decades of losing control and income to specialists, hospitals, and other providers, these challenges are an opportunity for primary care to retake its position at the center of the U.S. healthcare system. The Plain Yard Test is exactly such an opportunity. Until now, when a patient presented with symptoms indicating the possibility of bladder cancer, the most a primary care provider could do was refer the patient to a urologist. For decades, the urologist's standard tool for diagnosing bladder cancer has been the cystoscope. BCD has brought the Plain Yard Test, developed at Johns Hopkins, to Mississippi. The test is more accurate than a cystoscope, but it's non-invasive. The primary care provider can perform this genetic test and send it off by FedEx to BCD's commercial laboratory. In only 18 hours, the primary care provider can tell the patient with 96% sensitivity and 99% specificity whether they do or do not have bladder cancer.
The Plain Yard Test, it's simple. It can be performed in your medical provider's office. Detailed instructions with the specific protocol can be found on the forms inside of the test kits.
Each test kit contains everything a provider needs. Collect your specimen, and a day later, you have the results.
All the labels and forms are filled out prior to placing the specimens and forms in the pre-printed packaging to be mailed to the lab.
Together,
we will save lives.
It's free. We made it. We made it.
Visit our website, plainyardtest.com, for more information. Ask your medical provider about the Plain Yard Test.